If you're watching this video, you might be considering having a prenatal genetic test. And in this video, we're going to talk a bit about what that means. So broadly speaking, there are a number of tests available on the market, but they all come under the umbrella of non-invasive prenatal genetic testing, which is also known as NIPT. NIPT involves taking a sample of mum's blood and analysing the baby's DNA from that sample. It can pick up any chromosomal abnormalities or microdeletions which might be found in the baby. Having a prenatal genetic test is a really personal choice. Some people might choose to do it for peace of mind, or others for forward planning. It might be that you've had a high-risk screening test on the NHS and you want to have a more accurate result. NIPT is not widely available on the NHS at the moment, and the NHS would offer amniocentesis or chorionic villus sampling instead of NIPT. Now, amniocentesis and CVS are invasive tests and they carry a small risk of miscarriage at about 1%. So for a lot of women, that risk is not worth taking, and they would opt to have a simple blood test instead of the screening test which the NHS offers. We offer the Panorama test. This is a simple blood test which screens for the common trisomies, and these are Down syndrome, Edwards syndrome, and Patau syndrome. You can also screen for the sex-linked chromosome abnormalities such as Turner syndrome or Klinefelter syndrome. If you choose to, you can also find out the sex of your baby. Over and above other tests on the market, Panorama can also offer testing for 4 extra microdeletions. A microdeletion is where a small part of genetic material is missing. Microdeletions can happen to women at any age, whereas chromosome abnormalities, like Down syndrome, are more common as you get older. Examples of the microdeletions that we offer with the Panorama test are Angelman syndrome, Prader-Willi syndrome, and Cry-du-Chat. Panorama is the only NIPT which screens for triploidy. Unfortunately, triploid pregnancies rarely make it to term, but it's still really important to know about this because it can have some health implications for mum during the pregnancy. For example, it can put you at a higher risk of bleeding or at higher risk of a very rare type of cancer. In summary, the Panorama test offers you 3 different levels of testing, and you can choose what one is best for you. If you have any more questions about it, please do pick up the phone and ask us, and we would be happy to help.